Welcome to the channel. Today we're discussing becoming a medical device sales representative. Entry level. So there's tons of types of titles that you may hear that are entry level sales roles. One is going to be a sales specialist. This may be on-site or traveling sales specialist. You may hear the term sales counselor, community sales manager, pharmaceutical sales, medical sales associate, or just simply maybe entry level sales representative. Let's talk about day-to-day responsibilities. Well, for most of these titles, the day-to-day responsibilities are going to be very similar. You're going to identify potential clients such as healthcare facilities and or physicians, demonstrating medical devices to potential clients to explain their benefits, collaborating with medical professionals to understand their needs and providing solutions. Let's go ahead and pause here. Encourage you to hit the like button, subscribe button. Better yet, share this with someone who you feel like this is going to be beneficial. Let's jump back in. Pay range. Pat, talk to me. What does it pay? What does it pay, fam? Pay range for these entry-level medical sales roles is going to be anywhere from $45,000 upwards of $70,000 per year, fam. This is a combination of base salary plus commission. I've seen medical sales professionals entry level making over $80,000 a year, so it could be a great opportunity for you. What about time requirement, Pat? It varies. Typically, it requires a bachelor's degree. However, I've seen folks with an associate degree plus a number of years of sales experience not only get a position, but excel in this position as well. So if you have an associate degree and number of years of experience, go ahead and apply. Pitfalls we want to watch out for. First thing first, meeting sales targets while staying knowledgeable about medical devices. Very important. Handling objections and competition in the medical device market. Extremely competitive, fam. Pitfalls is using software tools, managing your time. Too many times I've seen a lot of great salespeople, they're able to sell, they stink when it comes to managing their time. This is a pitfall you definitely want to watch out for, especially if it's you, fam. And then frequent leadership changes. Generally, this happens for a couple of different reasons. One, your supervisor wasn't the right fit to begin with. Two, they got promoted within the organization or outside the organization. So what does this mean for you and why is this a pitfall? When you get a new manager, generally speaking, this means different sales processes and different strategies. So you're gonna have to learn the way they want you to not only showcase your sales, but to be successful in sales as well. And then lastly, it's stuck in the same job. We can't charge this to the game anymore, fam. You probably heard me on some other videos. If you're stuck in the same job, what I would encourage you to do is over-communicate when you jump into your next field. Over-communicate when you jump into your next field. Over-communicate when you jump into your next field. Yes, you heard me right. I said it 3 times because this is your career that we're talking about. Help your managers understand where you would like to see your career grow so they can help you get there. Sometimes the demand for your product or solutions, it plummets, or competition is too heavy, or newer technologies come in. So that's a pitfall you want to watch out for. Promotional pathway. Of course, these titles are very similar. Senior sales representative, sales manager, product specialist. I tapped the surface on a few of these to help you better understand. The healthcare sales and marketing manager, well, you're managing subordinate staff and the day-to-day performance of their jobs. You're truly their first line manager. Any issues they have, they're coming to you, so you have to be comfortable in your own skin to address these. And then ensuring that a project, department, milestones, goals are all met and you're adhering to whatever budget that's been approved for you. Tap the surface on a director of sales or sales director. You're managing and overseeing the sales operation in an organization. Your main duty includes designing plans to meet sales targets, developing and cultivating relationships with your clients, and evaluating costs to determine their products' pricing when selling to your customers. And then lastly is a product specialist. You can kind of jump into the IT field here because as a product specialist, they're experts in a product or a series of products, and they develop sales pricing, sales strategies, profitability strategies. They're recommending improvement for your product, looking at how we can increase revenues and identify new opportunities. Product specialists often conduct extensive market research, including surveys, desktop research, phone calls, and or attending rival product launches as well as conferences. So my final thought, final jam to you, fam, healthcare field is wide open. If you're looking to be a medical device sales, I would say go ahead and start now. They're looking for people like you. They're looking for people to make a difference. Maybe that difference can be made by you. Until next time,